We're going to start now. Welcome to the Standing Committee on Public Accounts. My name is Philip Christians, the chairperson of this committee. Next to me is Mr. Dustin Davids. I'm going to ask the members to introduce themselves, then the AG. And I know the audit committee is online. Mr. Strauss and Lawrence is online. But let's you do the members first. Members, over to you.
Good afternoon, Chair. My name is Leon van Wyk. I'm a member of the Public Accounts Committee.
Good afternoon, Chair. I'm Peter Johnson, member of the Public Accounts Committee.
Good afternoon. My name is Pat Lecker.
Good afternoon, Chair and members and colleagues. My name is Wendy Kaiser-Philander and I'm an alternate to this committee.
Thank you very much, AG.
Good afternoon, Honorable Chair, honorable members. My name is Lizo Nzamela. Thank you.
Good afternoon, Chairperson and the members. I'm Zinem Vimbeli from AGSA.
Thank you very much. Online.
Good afternoon, Honorable Chair and Honorable members and colleagues. My name is Peter Strauss, and I am the chairperson of the Wellbeing Cluster, and just assisting me is Dr. Gilbert Lawrence, also of that committee. Thank you, Chair.
Thank you very much. I'm going to give over to the Mr. Lawrence. You just want to show your face? Are you there?
I am your chairperson. Here I am. Thank you.
Thank you. Okay. AG, over to you.
Thank you very much, Honorable Chair, members. Gives me quite an excitement to be before you presenting
afternoon, members. Good afternoon, Minister and the department. The HOD, the Minister says, is about 2 minutes away. He had an emergency, but we'll just do the introductory, introduce everybody, and then by that time he'll be here. My name is Furlan Christians. I'm the chairperson of the Standing Committee of Public Accounts. Next to me is Mr. Dustin Davids. Mrs. Z. Kruter just left the room now, but let's just get the introduction from the members, and then we'll do the Minister and the department. Over to you, members.
Good afternoon, Chairperson and the members and Minister and his team. My name is Nomin Kondlo. I'm an alternate to this committee. Thank you.
Good afternoon, Chair and honourable members, Minister and officials of the Social Development Department.
Good afternoon.
I'm Leon van Wyk.
Good afternoon, Chairperson, Minister, colleagues, administration. I'm Francois. I'm part of the Social Development Committee.
And your surname?
Kamfer, Francois Kamfer.
Good afternoon. Nama French Mbombo, SCOPA member.
Good afternoon, everyone. I'm Peter Johnson, member of the Public Accounts Committee.
Good afternoon. My name is Pat Lecker.
Good afternoon, Chairperson, Minister and all officials. Wendy Kaiser-Philander, alternate to this committee and Chairperson for Social Development Standing Committee. Thank you.
Thank you. Over to you, Minister and department.
Thank you, Chairperson, and afternoon to those that I haven't greeted. Name is Jacques Lont, and the Minister responsible for Social Development, and everybody on this side will introduce themselves. Thank you.
Good afternoon, Honourable Chair and Honourable Members. My name is Robert MacDonald, Head of Social Development for the Western Cape.
Good afternoon, Honourable Chair and Members. I'm Charles Jordan. I'm the Chief Director for Children, Families and Vulnerable Groups.
Good morning, afternoon, members. Leanna Goosen, Chief Director, Social Welfare and Restorative Services.
Good afternoon, Chairperson and members. I'm Annemie van Reenen, the Chief Director, Service Delivery Management and Coordination.
Good afternoon, members. My name is Lizon Zamela from Auditor General. Thanks.
Good afternoon. My name is Monique Mortlak-Malgas, Media Liaison Officer to Minister Lont.
Good afternoon, members. Bernard Lachette, Head of Ministry in the Office of MEC Yakulont.
Good afternoon, members. Yamif Dahring, Acting Chief Director, Business Planning and Strategy.
Good afternoon, members. Chairperson, my name is Petronel van Wyk and I'm the Acting Director at Operational Management Support.
Good afternoon, Chairperson, members. Tasneem Rakib, Director Supply Chain.
Online, is there anybody online?
Hello, Minister. It's Gilbert Lawrence here from the Audit Committee. Thank you, Chair.
Good afternoon, Chairperson and members. Ritvan van Rensburg from Provincial Forensic Services.
Okay, I think that's it. Oh, yeah, go ahead.
Good afternoon, Chairperson and members. Mornay Williams from Internal Audit.
Thank you very much for the introductions. Members, we are going to do Part C, Governance. That's from page 91 to 106. And then we'll do Part C, and then I'll allow for questions. 2 questions per member. If there's a follow-up, you can follow up, and then we'll get to a second round. And then we'll go over to Part E, PFMA Compliance Report. That's just 155 to 167. And then we'll do the last one, Part F, 168 to 245. I'm going to give the Minister and the HOD opportunity just for introductory remarks, and then we'll go straight over to governance. Thank you very much.
Thank you, Chairperson. I do know that colleagues have been having a long week, and some sessions might take longer than others. But from my side, I want to firstly just thank members of the committee for the diligent work in doing the oversight. And then a special word of thanks to the officials in the department for the sterling work they have done. We are proud with what has been presented to you, in spite of a difficult period that the department has gone through in a fiscally constrained environment. So those are the only words from my side. I am looking forward to engaging the committee. Thank you so much, Chair.
HOD?
Thank you very much, Chair. I think from my side as well, just to acknowledge the efforts of all of the officials involved in the period under review, as well as I think to look forward to a robust but thorough session. Thank you.
Thank you very much. Members, we're going to go to governance. It's page 91 to 106. Is there any questions on governance? Member Nkontlo first, and then Member Petleka, Member Kamfer, in that order. Thank you very much, Member Nkontlo.
Thank you, Chair. My question is on page 93 on the key risks, as documented by the department. The second risk on the increased household hunger in the communities. My first question there is that can the department give specifics when you say there's a significant increase in the number of vulnerable households? Can you provide us what does that mean in terms of numbers and areas in which you have picked this up? The second one on the same one is that the department is funding the food distribution centers and CNDCs. My question is, have you done any impact assessment of this program to determine its success or challenges? Thank you.
Thank you. Member Lecker.
Thank you, Chair. Good afternoon once again. My question, Chair, is on page 101 under financial management. The first line there, Chair, which speaks to I think just after the second paragraph in relation to the under expenditure of 20 million. Even though I understand that the budget spent was 99.3, but I think it's going to be important for me to understand exactly why the 20 million under expenditure. Does that mean there were certain departments or certain line items that were shortchanged or what? Thank you.
Member Kampf.
Thank you, Chair. Chair, page 93. I would like to ask you what measures have been implemented to address this issue. Firstly. Number two, Chair, we would like to receive a report detail to the number of NGOs that the department stopped with funding due to constraints between 2019, 23, 24.
Thank you. Got it, Minister Nchudi, you got those questions? Those are the first questions.
Thank you very much, Honourable Chairperson. The first question from Honourable Member Nkondlo regarding the increase in household hunger. During the COVID disaster, a number of different research institutes implemented surveys that included questions on household hunger alongside the households survey that is done by Stats SA in partnership or with some support from research organizations and the Department of Social Development's own population research unit. So the households surveys that have been conducted have pointed to increased levels of hunger at household levels, increased number of households that are running out of money for food before the end of the month, as well as the issue of inflation of food costs that is making food more difficult for people to afford to have sufficient food. There is also the stunting survey that is being conducted by the Department of Health that is flagging certain trends as well. So there's a number of different pieces of research that inform our assessment that there is an increase in household hunger. And the issue that we've tried to address during the post-COVID period has been to try and expand the capacity temporarily of the community nutrition and development centres and the community kitchens to get more food available to people who are struggling, so that we can try to avoid severe malnutrition occurring. I think the question on funding of CNDCs and food relief programs and whether we've done an impact assessment of the programs, we haven't had the opportunity to do that. The programs were very rapidly implemented during COVID. It wasn't a time when we were able to make much funding available for anything along the lines of a long-term assessment. But what we have picked up on is the demand or the need for those programs has been high based on surveys of the communities where those services are rendered, in terms of where they are still running short of food, even in spite of what we're putting in place. So we knew that the need was greater than what we could meet, but we met as much as we could. But that is also why we partnered with over 200 NGOs through the Western Cape Food Forum to try and get private donated food relief coming in alongside what we fund, because social development alone wasn't sufficient. I think what we found in the end was that there was more donations coming from the private sector at one stage than there were from social development or government in general. So yeah, I think the need is clear. The impact of those programs, though, in terms of addressing hunger, from what we are seeing, is that we need to look at more sustainable solutions in the longer term, and particularly also look at the nutritional component, because unfortunately the programs we're providing are quite basic food. And the thing is that we are sitting with malnutrition problems in communities that are growing because the nutritional value of what is being provided isn't always sufficient. It's very basic foodstuffs without a lot of nutrients. So that is where we're looking for the new term of office to see where we need to go to now with food security, in partnership with health and the education departments, as well as agriculture. The question from Honourable Member Lekker about the under expenditure, I will ask the CFO to speak to that question. Thank you.
Thank you, HOD, through your chair. Firstly, honourable member and chairperson, my apologies for coming late a little bit. I'm Juan Smith. I'm the CFO for the department. In terms of the question, firstly, just to mention that this whole paragraph on financial management relates to 2 years prior to this year. Okay, so the one relating to the 20 million, that was in the 21-22 financial year. And in that year, we had a number of underspends due to our compensation of employees, and that was the staff exits. So we had more staff exits that we can employ during that year. Then we also had a delay in the operationalization of our special vehicles. So we were dependent on at that stage it was public works, at that stage, and GMT for these vehicles. So there was some delay, and that was about 1.2 million that we couldn't spend. And then there was also some some COIDA payments for EPW workers, EPWP workers that we couldn't finalize. And then also some of the underspends were due to us using electronic platforms, meaning that we were working more remotely during that time already. And then for the 22-23 year, it was 8.5 million underspent. And the current year under review is 4.3 billion underspent, which is also mainly COE and due to the exits that we had to face. Thank you.
Thank you, CFO. I think just to also add, I mean, so there's been a downward trend in the underspend from 20 million in that first year of the 3 years down to 8, and then in the year under review, it's around 4 million. So I think it does also reflect the fact that we've moved out of the disaster period, and it's become a little bit easier to work with the finances again in terms of predicting and so on. So the under expenditure is coming down. There weren't programs that specifically suffered as a result of underspending, but we did again have some underspending on compensation of employees. As the CFO has indicated, it's an ongoing difficulty because we have Treasury imposing quite a strict regime on the use of compensation funding, and at the same time the very slow process of filling posts. So inevitably we do tend to end up with a little bit of underspending around compensation. But the 4 million in this the year under review is the lowest underspend we've had for a long time. As you can see, it's gone down from 20 million. The question from Honourable Member Comfort on the number of NGOs that DSD stopped funding. We do have that information. It's and we can provide it, but we'd have to provide it in writing because it's for several financial years. But we can provide that information. Thank you, Chair.
Thank you very much. Is there follow-ups on those questions, or can we move to the next questions? Is there no follow-ups, Member Mkontlo?
Chair, my follow-up, I think, is on the impact assessment. If the HOD can indicate by when do you think you're going to do the impact assessment? Because if the program you said started in COVID times, assuming COVID is the period of 2019, surely at least you've got almost more than 3 years of the program running, which enables you to do any impact assessment so that you don't continue to argue that there is an increase and there is a need, and you can't therefore substantiate that by quantifying what you are providing. And I'm raising this because if you look in page 94, you also there are concerned about a compromised or what you term poor quality, of services rendered by NPOs. And given the fact that, your program of CNDCs is being done by NGOs, so it becomes logical that you need at least to do some assessment so that the quality of work and the spending, can be justified going further. So I would think it's important for us to know at what point, as you see the need increasing and there may be more resources required for this intervention, when are you doing an impact assessment? So I think that's my follow-up, Chair. And just to ask, in the non-compliance, what is the meaning? The last sentence says limiting the reduction of funding in the hotspot areas as you're mitigating. What exactly do you refer to, and which are these hotspot areas that you saying you foresee that there may be a reduction of funding in the future?
McComfort?
Thank you, Chair. Chair, that is a following up a question. Can I proceed? Chair, page 96. Chair, that is an open case. I would like to ask you, what is the details? Is page 96, that is the case was opened in 31 March 2024. Can the department give us more details? What happened with the case to give us more details, please, Chair? Thank you.
Actually, just maybe just on page 94, and I know, I mean, I just want to throw this in because the non-delivery of services from SASSA is also a big problem. Page 94. So I know you're not responsible for that, but that also have a devastating effect on people that dependent on their grants. How do you deal with those type of things? What is the communication with SASSA, or how do you deal with that? Because that is a risk. If you can just answer that. Member Leon van Wyk's got a question.
Thanks, Chair. Also just relating to the NPOs, and I was considering possibly dealing with that later on, but we might as well look at that now. And I think the question I probably have relates to how do we perhaps tighten up governance aspects through guidelines, through some form of to ensure that those MPOs are performing at the level that they should be performing, that the department is also to ensure that the funding being provided is being spent correctly, and that the management that is undertaken within that MPO is also at the standard expected of from the department. So I think it's sort of the qualitative effect of the funding that goes through MPOs, because if we look at the from a budgetary point of view or an expenditure point of view, your expenditure out of total expenditure is probably roughly 40% goes via the route of MPOs. So, I would have thought one wants to try and be fairly tight on how they are spending their money and reporting and so forth.
Thank you very much. That's the questions. HOD.
Thank you very much, Chair. On the question from Honourable Member Nkondlo in terms of impact assessment, I think we do different types of assessment. So we do monitoring and evaluation and of the NGOs, and that we do already. We are doing that to make sure that the NGOs are doing the work that they're supposed to do with the money we've given them. So that monitoring work is done. The programs from our head office, they go out to the NGOs, they check to make sure that they are feeding the beneficiaries they are feeding. They check to make sure that the food is up to scratch. They check to make sure that the NGO is keeping true, accurate records of what they're spending money on and all those sorts of things. So that we do. The beneficiaries that are assisted are also assessed and checked for the need, and we do make sure that the right people go and get that food, and it's not people that are just taking chances. So that kind of work we do. I think maybe with my understanding of impact assessment would more be like the long-term effects of feeding schemes. So one maybe would then look at things like whether that is serving to prevent children from being underweight or people from running out of food each month. So that's a bit of a different, an impact assessment is a more long-term and a more detailed and quite expensive study to implement. So in terms of what we implement, the services we implement, we do monitor and assess them for compliance with what we want them to do. That we do. So I think it's just important maybe to clarify what I mean when I say we haven't done impact assessment, because we haven't done that long-term assessment. What we have done is the ongoing assessment that the quality of the services is good. And then the need is being identified because when our social workers go out to these community centres that are feeding people, and they see the queues and they talk to the people, and then they talk to the NGO, they find out how many people they have to turn around each day. And they find that the people are even sharing, if the people get a sandwich, some of them are even sharing that sandwich with other people who come just to make it stretch a little bit further. So there's definitely, the need is not something we are doubtful about. I think we can see there's a need out there. There's not any doubt about it. But we are, I think one of the impact assessments we need to look at is the quality of the nutrition. And that is something we need to see how we can supplement. One of the ways we have been trying to supplement that is working with agriculture to get communities working with food gardens to start growing some vegetables and other things that they can supplement their diets with, because the community kitchens tend to produce food that is not always covering all the food groups because of the cost limitations. So I think that's our main thing we have to tackle going forward. The question about the reduction of funding, where we talk about trying to limit the reduction of funding, I think the point that's being made there is that we're facing funding cuts that we can't avoid. The Treasury is reducing the money available to the provinces, while the budgets are being stretched by the wage negotiations. So when the salaries go up of our public servants, that means there's less money left over for the NGOs. So what we are talking about in terms of reduction of funding is that because we have to reduce funding, we are looking to avoid reducing funding for the most critical services like child protection services and services for children that have to be placed into secure care and other things that the law says that we as a department have to do. So we are obliged to render those services by law, and we have to prioritize those services. So with the budget cuts, our approach has been to try our best to preserve the services that we have to render, which means we've had to cut back on services in other areas that are services that are still important, but that we're not obliged in law to render. And those are very difficult decisions and choices to make. And as you'll see, in this financial year under review, there was quite a big reduction in the allocation for food relief, for example, because we got quite a lot of extra money during the lockdown period for food relief, but that money then wasn't going to continue to be available from Treasury. So that we had to reduce. And there's a lot of other things like that. We've had to reduce funding for the older persons service centers as well. Another thing that is really useful and really good in communities, but it's not something that in law we have to do as a department, whereas taking children away from abusive homes and placing them in safe care is something we must do. So those are the kind of trade-offs that we are talking about in prioritizing and reducing or limiting the reduction of funding to safeguard essential services. In terms of the Honourable Member Comfort's question about the case was open in March 2024, I'm just trying to find that I couldn't see that it was, you mentioned that it was on page 96. I'm just trying to find where that is. Is that the cases from Provincial? Okay, it's Provincial Forensic Services. So it's the three cases that are being asked about. So those three cases are currently open with Provincial Forensic Services. They are in the process of investigating those cases at the moment. They haven't concluded on them yet. The cases were reported during the year under review. And so it's during the period from the end of March in 2023 up until the end of March this year. So during that period, we received 3 new cases. And those cases all related to allegations of misuse of funding at NGOs that are funded by the department. The one report came through a whistleblower, and the other reports were emailed to us by complainants. So we don't know whether there's truth yet to those allegations. They are being investigated by Provincial Forensic Services at the moment. So we are waiting the reports on those matters. The question from Honourable Member, from the Honourable Chairperson, how does the department deal with the risk of non-delivery from SASSA's side? I think the risk as articulated there is broad, but the main concern I think we've had is on occasion SASSA has had to change their systems over for example, disability grants. And then we've had a big problem where there's been a backlog of persons with disabilities not getting their grants, and then they come to social development looking for help. and it creates quite a lot of chaos. We have to try and assist those people, and they come to our offices looking for help. It's very disruptive for them and for our own clients who are busy with us. So that's one of the issues. Another issue is, for example, where SASSA has a problem at one of its local offices that we share with them. And then there's a protest at the office, and that also then affects our clients who are trying to come to social development for services. So those are some of the risks. The other area is with the availability of SASSA services. Postbank has, as you know, been closing down pay points, and that is then becoming a huge issue for a lot of our clients. They can't get to the places they used to get for their pay. So SASSA grant beneficiaries are then suffering with that. So there's a lot of aspects to the issues that are affecting SASSA that then spill over into social development space. And I think we've since our new minister's taken up office, he's prioritized engaging SASSA regularly to start trying to manage down some of these risks. There's been several engagements already where we've looked at how we can assist by also partnering with municipality in the metro to find additional spaces so SASSA can maybe set up offices in communities where they don't have a footprint yet. We've also been looking at how we can assist with the payments or rather the provision of urgent relief in disasters, because that's another area we're picking up, that SASSA isn't able to provide food and blankets quickly enough because of their audit requirements. So we're also looking at how we can partner around that to try and get something happening quicker there. So we just need to improve, I think, the communication between the department, SASSA, the public, and the municipalities to try and resolve some of these issues. The uncertainty around the COVID grant is also another thing. We still don't know how long that's going to carry on for, whether that's going to become a basic income grant. And we are involved in the national policy discussions around this that are ongoing, so that hopefully we can get some insight into where this is going to go. So we are pulling them closer, and so far the relationship has been good. And we've seen SASSA also now join the First Thursday engagements where they've made themselves available to clients who come in looking for help, which is really useful because we do get a lot of SASSA-related inquiries that we then have to pass on to them. So now they're also available to directly assist the public. The question from Honourable Member van Wyk about tightening the governance aspects with the funded NGOs. There is already a lot of legislative guidelines for NGOs in terms of the MPO Act, including the requirements around their constitutions being in order, regular AGMs being held, submission of audited financial statements, but there's a huge number of NGOs that don't meet those requirements. And the National Department of Social Development is busy deregistering long-standing defaulters at the moment, because there's the MPO database is filled with NGOs that have been non-compliant for 10 years or more in the system. We're quite strict about which NGOs we fund, so the NGOs need to be compliant and up to date in terms of the MPO Act before we even consider funding them. The second thing is that the contracts we put in place that the NGOs are funded against are very specific about how they can use the funds that we provide to them, and also very specific about the accounting that they have to provide for the use of those funds. And that includes the submission of audited financials to the department within a period after the end of the contract period. So if they have a transfer payment agreement that is up until the end of March, then I think it's within 6 months that they need to submit their audited financial statements to the department, failing which we then start to take action against them. The other aspect is that the NGO needs to make sure it uses the funds for its intended purpose. So we do our monitoring of their outputs to make sure that they have actually used the funds as stipulated in the contract. And our teams go out and check on the NGOs to see what they're doing and make sure that things are running properly. We also we have performance information that we receive from the NGOs. It's also audited by the Auditor General as well. So the Auditor General checks the integrity of the data that the NGOs are submitting to make sure that it's actually it's reliable, accurate, and complete. So there are systems in place to check these things. And then in terms of the quality of the services as well, a lot of different types of services have norms and standards prescribed for them, whether it's substance abuse treatment programs, there are prescribed norms and standards. Older persons programs, there's also prescribed things, and child protection, all the children's homes, all of them have a legislation that speaks to the quality of the services that has to be rendered. So we also hold them accountable to those standards. And we check all of their systems. So there is a lot of policing, as it were, in place around the NGOs that we fund. And we do have a very substantial team of people at our provincial office that are dedicated to that. And those teams comprise monitoring officials, along with social workers who check the norms and standards and the client data and so forth. We are also looking at starting to get the NGOs onto the electronic case management system that we call SWIMS for case management, so that we can integrate their cases with our system and start to track the cases that are dealt with by the NGOs alongside our own. But even with the child protection services and other things, the NGOs also have to work through us when they place children. So we also keep a register of all the children that they assist and those sort of things. So there's a lot of checks and balances that are in the system. But I think we also see that with some of the NGOs, they do struggle with governance issues. Some of our NGOs are very strong, but some of them are on the edge of not managing. And we actually have to then try and work with them to see if we can get them working properly. We don't want to close them down if we don't have to, especially if it's in areas where there is not many services. There's some areas where, you know, you've got plenty of NGOs to choose from, and if one isn't doing a good job, you can find another one. But in many of the rural areas, there's some of the NGOs are the only thing there. So we've got to try and make it work at all costs, and if they really can't come right, then we have to step in and change the service. But if one of those NGOs is strategically placed, then it's worth fighting to try and get them right first. So I think we are pretty tight on the NGO management, but yeah. I think the going forward, we're going to try to further tighten it up, but without putting too much regulatory burden on the NGOs. So once we start getting them to use electronic systems, we find that it makes it easier for them, and it also strengthens the oversight.
Thank you very much. Member Pat Lekker's got a follow-up. Member Lekker.
Thank you, Chair. A follow-up in relation to NPOs and the data thereof that the department has in its possession. I would like to get an understanding in terms of the obstacles that may have been picked up by the department in those various NPOs. I want to understand, Chair, with the best practices that are there, from or seen from other NPOs, what can or what could be done by the department in ensuring that there's financial stability for those other NPOs, that they do not have data thereof? Because I believe if there are best practices, such must then be shared in order to assist compliance with others or in whatever way. But at the end of the day, you would have to be able to mitigate the risks in ensuring that there's financial stability, but also it talks to the planning by the department in attending and addressing those NPOs, in as much as they are not, they are outside of the department, but they happen to be some of the stakeholders within the department itself. So I just want to get an understanding into such. Thank you, Chair.
Sure, is that the only follow-up? Thank you. Is it me?
Thank you very much, Chair. I think the department does have various levels of intervention depending on the needs of the NGOs, and some of them are very financially stable. well established, and they can even sometimes help other NGOs as well with capacity building. And there are some NGOs that are very good with that, like Community Chest and so on, have been known to help other NGOs develop their fundraising abilities to improve their liquidity. We do keep track of the NGO's liquidity and their financial health. And where there is problems, then we engage them and we try to connect them either to our own NPO help desk for assistance with training around fundraising. We try and link them to partners. And we're also now looking at ways of channeling private sector donors more into the NGO space to help them, because we realize that as our funding recedes, that we are creating a void for the NGO sector, and we need to do everything we can as a department to try and find extra help. So we are reaching out to the private sector and in the process of taking that to another level in the term ahead. So I think that's going to be one of our big priorities for the coming term, and certainly we also, where we can, help with getting the NGOs better trained around fundraising and financial management. We do. It is a little difficult sometimes because not all NGOs have very strong boards. Some NGOs appoint board members who are very passionate about what they want to do, but they don't necessarily have formal training or background in governance. So that is sort of one of the big stumbling blocks that we're picking up across the board. That's a big problem. But the other thing is the NGOs can't pay as high salaries as government or the private sector, so they also have difficulties with retaining staff and those sort of things. So we have been engaging particularly with strategic sectors like child protection to work with them and see how we can also help them to become more efficient by partnering with each other too, and maybe sharing some of the administrative burden among them and reducing duplications. We have some towns, for example, where you've got small town and you've got 3 different child protection organizations working in the same town. And we've been saying to them, why don't you rather just arrange as just one of you, so that you don't each have an office that you have to pay rent for, and you don't each have admin staff working and everything side by side, so you can try to create efficiencies. So we're working with them in that way as well. We're also looking at bringing our staff into areas where they can't sustain staff. There's a lot of rural areas where the NGOs can't find people at the salary they're offering to work for them. So then we've said, well, maybe you take over an area which is easier for you, and we'll shift over to the area that we can take on. So there's a lot of that sort of work we're doing with the NGOs as well to help mitigate the financial crisis that they're finding themselves in.
Thank you very much, HOD, for that explanation. Can we move on to Part E? PFM Compliance Report 155 to 167. I see Member van Wyk first. Member Kondler second. Member van Wyk, you can go.
Thanks, Chair. We at the meeting before lunchtime, one of the members inadvertently, I think, strayed into E, and under the irregular expenditure, there's certain expenditure relating to it was 6.4 million relating to staff, and possibly the HOD could just repeat what he said then, because there are different members sitting on this side on the Public Accounts Committee from the members on the Social Development Committee that met earlier. So that may just help in that expedition. And then secondly, I've got in dealing with supply chain management from page 163 onwards. There are a number of particularly security services or protection services, as they are called, extension of contracts that have taken in place, and limited bidding. If we can perhaps get an explanation there. I think, Chair, as you will remember, when Public Accounts Committee met with police oversight and community safety, we also found numerous of similar type of security contracts that there were extensions on. And I think probably as a committee, we are a little bit concerned that this now seems to be there's a repetition of what we'd seen earlier. So I think we'd like the explanations there.
Your first two.
So those are my
first two. Member Kontler.
Thank you, Chair. I'm covered by Members Van Wyk. I just want, I think as part of that, if the department can just explain on page 166, what is emergency procurement in the context of a limited bidding, and what would trigger such. The second one, Chair, is on the, okay, no, I see there is no, I think, contract variations. I think I'm covered on that one question.
Thank you. If I can just ask this question on page 162, invoices paid after 30 days or agreed period. There's 15 there, but out of how many? How many payments you had to make? 15 out of how many? What's the percentage or what is the amount? And then as I asked the other departments, many of the departments have a description why it's late. So always say this is a public document. The public don't ask questions. So if, we don't know the 15 is late. And then the other thing is we don't know, did it take 5 extra days or 10 extra days? We don't know that. If you can just give us some details pertaining to that. Is there any other questions, members, before the HOD answers? And then I'll give another round. Thank you very much. I'll give another round after this. Thank you, HOD.
Thank you very much, Chairperson. In terms of the question from Honourable Member Van Wyk, the regular expenditure relating to staff appointments, we did report on this in the previous scope as well. So this is an update, as it were. The Public Service Commission flagged the appointments of senior managers who had been appointed with the MEC on the panel. Now, the MECs in the Public Service Act are empowered to sit on the panels of appointments of level 16 and level 15 staff members. There's a lot of departments in the province that have level 16 HODs and level 15 staff reporting to the HODs. In social development, the HOD is on level 15 and the staff reporting to the HOD are level 14. The erroneous assumption was made that the MEC would then be permitted to sit on and chair the panel for the level 14 staff members, which the Public Service Commission later picked up is not applicable because there isn't an empowering provision in the Public Service Act that makes it possible for an MEC to sit on a panel for level 14. Only for level 16 and 15. So if it doesn't say level 14, then the MEC is not empowered to do so. So the Public Service Commission then found that those appointments were, as a result of that, irregular in terms of the Public Service Act. The Commission then required that the department rectify that irregularity. And a report of this was submitted and tabled in Parliament by the Public Service Commission at the time. So the department then approached the Labour Court for seeking an order to rectify the appointment by either setting it aside or alternatively confirming the appointment notwithstanding the procedural irregularity. The Public Service Commission report found that there was no ill intent or that there was no malafides in the process. So the report also, in all other aspects, identified that the process had been in line with the ordinary recruitment selection process that had been done correctly in all other aspects. As such, the Labour Court ruled that the appointments need not be nullified, but rather that the appointments could then stay in place, and notwithstanding the procedural irregularity. The expenditure then on those posts was then deemed to be irregular, but condoned after or rendered no longer irregular due to the fact that the court had regularized the appointments. And that then closed the matter from a regular expenditure perspective. So that expenditure is then not going to be irregular on an ongoing basis. The question about the supply chain management extensions, I will ask the CFO to come in on that one.
Thank you, through your chair. In terms of all these extensions for the securities and even some of the limited biddings that we've indicated, they are all connected to the transversal framework agreement. The transversal framework agreement is an agreement that Provincial Treasury has put in place together with all the other departments for security matters. So we as a department also bought into that. As from the last financial year, the Provincial Treasury made a decision that not to continue with that framework agreement, and then just to extend it for a 6-month period. And this was the reason that all departments that were participating in this framework agreement also had to extend their security contracts. Then there was also a further extension, another 6 months, because Provincial Treasury then indicated that they needed more time to conclude on the transversal contract, to bring about a new tender and a new service providers for this process. In that case, we had to then, because the time was not on our side to further extend, we then went the route of limited bidding, to then just to appoint those service providers so that the service could continue in terms of that. I don't know if my colleague wants to add anything. Tasneem, thanks.
Okay. Thank you very much, Chair. So it's a continuity issue that we had to deal with there. The question from Honourable Member Nkondlo about the emergency procurement was at the Beaufort West. So the emergency procurement was triggered by the unexpected major power failure in the central Karoo that occurred when some of the major power lines were destroyed in a storm. The department was alerted to the fact that there was a large number of people that had lost their perishable foods due to their refrigeration failing, as well as a lot of people not being able to work and so on. So there was a situation was created where we needed to urgently respond with food relief to the affected families. And the department then mobilized a service provider to provide food parcels that were distributed in the central Karoo during that period of about 2 weeks, where there was no electricity. So that was why the emergency procurement was done. It was triggered by the disaster situation and the need for a very rapid response. So that is what normally is used to, that's normally when the emergency procurement provisions are used, is in an unforeseen crisis situation. Then the question from the Honourable Chairperson, the 30 days invoices, the 15, how many of total payments were made versus the 15, and also the reasons for these 15 being late. I'll ask the CFO to come in. Thanks.
Thank you, Judy. Through your chair, Chairperson, yeah, the number of invoices, it was 9,520, and that excludes our GMT invoices, because for every car there's an invoice, so we exclude that. But that is a total of 9,520, and that relates to 0.16%, the 15 invoices. These 15 invoices are from one service provider, was Vodacom. And this resulted in a late payment due to, firstly, there was a dispute with the company. And after they have dealt with the dispute, they eventually then found out that the dispute was not warranted. And then we had to pay it. So that was the main reason for that. Thank you, Chair.
Thank you very much for that. But you see, actually, the explanation makes sense. Then you don't have to ask the question, but it's not here. So I'm just asking next time, just put in something there to explain. Then we don't ask the question. Member Conlon, you got a follow-up? And then I know Member Vega got another question. That was you too. Okay, Member Conlon, over to you.
Oh, thanks, Chair. Just want to ask, in an emergency procurement as explained, so how do you choose this particular service provider?
Yeah.
I'll ask the CFO to explain the process. Thanks very much.
Chairperson, through you, in terms of an emergency, normally we would then obviously look at the service provider, obviously that is suitable, that is in the vicinity, in the area, and that can also render the service. In this case, it was about the procurement of food parcels. So the food then had to be surrendered. And then there was what we call almost a quotation process that we had to then do, which was not the normal one, because normally if it's a tender, we had to advertise it and we had to give certain time in order for the tenderers to submit, and then we need to evaluate those things. So in this case, because of it's an emergency, we then went the route of the quotations and then evaluating just based on that the most suitable service provider that can immediately render that service at that point in time. Check.
Can we move on? Answered?
Go. Thanks.
We'll do a resolution on that. Thank you very much. Members, then we move on to Part F. Is there any questions on Part F? I see Member van Wyk. Member van Wyk first.
Thanks, Chair. I note that there are some good explanations through a lot of the notes over there, so that is much appreciated. On page 214, there are contingent liabilities in claims against the department that have been recorded at just under 28 million rand. I noticed it's a legal matter, and possibly that's if we can just get some insight into that we just understand that process as well. Thank you, Chair.
Member Comfort, with you.
Thank you, Chair. Chair, my is simple. Is page 87. That is the current liabilities.
Just give me the page again because I'm confused.
187.
187.
187, yes, Chair. That is about current liabilities. Huidige laste in Afrikaans. Chair, my concern or my question is, what I see there is surrounded funds. What I currently will ask you the department, what was the purpose of this funds, and why if I read correct, what was the purpose of this funds? Did it go back to the revenue? What was the purpose of this funds? Thank you, Chair.
Thank you. Let me just throw one question in. I'll give you an opportunity. Page 216. At the bottom, employee benefits. Also included other is an amount of 818,000 at 31st of March 2024 in respect of provision made for an ex gratia owing to Minister Fernandez. At the State Department, gratuity, at this State Department is not able to reliably measure the long-term portion of the long service awards. If just an explanation on that, the gratuity on the previous minister, Member Nkondlo.
Thank you, Chair. On page 185, on the footnote there, on the unspent outstanding payment to the service provider, if you can be provided with the detail of what are the reasons for this non-payment and if it has been paid by now. And then on page 201, Chair, on goods and services, maybe if we can get some understanding. What is this catering? Was there a party there by the department? If one considers from 2022 to 2023, that would have had such a spike on the catering budget from 813,000 to 3.3 million, including, I think, on the travel and subsistence. Maybe the department can shed more light about those. Thanks, Chair.
Thank you. There's also a spike in the legal services. If we can just in that same page. Thank you very much. That's the question for now. HOD, over to you.
Thank you very much, Chairperson. I'll ask the CFO to speak to all of those questions, I think, if you're okay with that.
I won't come late again. On page 214, the contingent liabilities, maybe just an explanation there. We are also charged with some of these liabilities, and these are through court processes or where the legal people come and put some claims against us. So these are claims that is done, and then we work via our legal services in the Department of the Premier, and then they facilitate those processes. So these are all those liabilities. There's 20, there's about 26 cases, 26 liability cases, and that total of 28 million. Just to mention that the one case that was previously at about 1.4 million was elevated by their legal people to indicate that they also now wants to claim for loss of income and or other expenses, and that is the one that actually pushed up our total of 28 million by 19 million. So from 1.4 million, it increased to 19 million. So it's still in the process of being defended by our legal people as well, in terms of that specific matter. And then there's quite a number of other matters. Of that 26 cases, only 4 of those cases has got values, and we will be able to see that also in the annexure at the back. The other cases has got no value. Those still needs to be determined. We still, every month, we have a meeting with legal services and we look at progress, due to there's no quantum at this point in time. I hope that is sufficient, Chair. Thank you.
But just to mention that one you referred to, the claim that goes back to 2008 or something, huh? 2008. It's a motor vehicle accident involving the claimant who's claiming damages against the department because of the involvement of a government garage vehicle in the accident. So that is the nature of the claim, and it's still in court.
Chair, the next question from the honourable member around the current liabilities and what was the purpose going back to revenue. Chair, in terms of our financial procedures and our processes, we in government work on a cash basis. So we work from one financial year to another financial year. So we can't carry over. If we do, we must roll it over. So all the income or the revenue that we earn, whether it is parking fees or we get rental on dwellings, and even our own budget that we don't spend, that we must surrender to the provincial treasury. So those are then during the year regarded as a liability that we need to pay over every month, portion by portion. At the end of the year, we then reconcile everything and then pay the correct amount over to the provincial treasury in terms of that. Just want to go to that page. Which one is that? The 1.6. It's the one for the minister. The ex-gratia, yeah. In terms of that. Chair, as we know that at the end of the term of the minister, she then also chose not to return. And therefore, in terms of the DPSA process that has been governed, that we need to then do that ex gratia payment. And there is a formula calculation. I can't get it out of, but that calculation we then have to perform. At that stage, by the year end, we could only do it up until that point because we still had to look at any other expenditure that we need to offset against any other further payments. Hence the reason we couldn't give a complete figure, but only an estimate at that time. Further than that, we've then completed this whole transaction. Thank you. Yeah, on page 85, 185, that is in connection with the conditional grant. That's our EPWP conditional grant. The reason for the underspent or the outstanding payment, as were indicated, is because the service provider, they had to complete the work up until the end of March, and then only then could they invoice us. And therefore, we could only pay it in the new financial year. Unlike a transfer payment where we normally pay the funds in advance, in the case of a procurement exercise, we had to first continue and complete the work and then submit the invoice. And therefore, we had to delay the payment until the new financial year. But all the services was rendered and the service provider was fully paid in terms of that conditional grant. (201). The catering. Chairperson, the catering increase is mainly due to our parenting program that we have introduced. Let's see. Yeah, the catering is the additional social welfare projects that we've also undertook during this year under review. And then, as I said, mainly the parenting programs. This is where we have these parenting programs within our regions. Together with the social workers, we invite the parents, families, and this is also where we cater for them during those sessions that we had to do mainly. And then traveling and subsistence, similar because of the traveling that the staff had to do to get closer to where the people find themselves. So that was also part of the increase that also occurred there, as well as also our accommodation and traveling that we normally pay for as the staff. Legal services, those are state attorney fees that we must pay, and the year under review, we basically just had more litigation cases that we had to deal with in terms of that. Thank you, Chair.
Thanks, CFO. I think just to add, Chair, also we were coming out of the COVID lockdown period, so the years before there wasn't as much traveling happening. There's a lot of things happening on Teams and stuff, and then this year, under review, the staff really began to get back on the road again. So you would see that travel costs increasing. I think that the legal fees, I'm just trying to think now, what was the specific cases, because we had one of the cases around closure of drug treatment centres, which was an important case in the High Court to create a precedent around our powers to close drug treatment centres. And it was also that other case as well, with the result relating to the labour matter. And then I think there's also the ongoing cases with which the contingent liabilities are involved in, where we've had to pay psychologists. I think it was a psychologist to do an additional assessment of the person who's claiming money to get our own view on the damages that should be claimed. So there was quite a few different things.
Thank you. I'm going to throw one more in, and then I can give members opportunity. Just gifts and donations. You've got a note on 2.4.1, and then of course you have the annexure 1D. All the stuff is really nice, and then one stands out: a gift card, flights, ticket to Colombia, and accommodation and meals. Who was that given to? The flight tickets and accommodation and meals to Colombia. Just see if other members want other questions there. Member Nkontlo. Go, Member Nkontlo.
Thank you, Chair. Chair, on page 180. Yes, 180. I think they are regarding, program 2. One is just interested to check with the department that if one looks at the split of the budget of program 2, that 57% of the expenditure is on sub-program 1 of management and support. Does then means that the bulk of the service delivery is spent on management and actually admin provision. So question for me is do you believe that admin and management, in as far as this program is concerned, is the best way, given this is supposedly to be a service delivery issue? Is it a public choice because the bulk of the money goes to more management in the program? I think that's my question in terms of the split of money of that specific program 2, when you look at how that budget is allocated. So that's my question. And then I think, Chair, on the issue of the catering, and I think the response is that there was an introduction over and above the issue of COVID. There was an introduction of a parenting program. So perhaps the department can share with us what was that program about, and the detail of what was this catering that you were spending that, has spiked the money of the department from what was spent in the previous year to the money that they spent in this reporting year. Maybe we can look at it when they submit that detail to us.
you, Member Nkondlo. Just another question from my side. I know there was material misstatements on program 3, but it was corrected. But we had a briefing note from the AG request to the MEC. Our call to action is that the MEC should, on a regular basis, obtain detailed feedback from the accounting officer on progress of the department in regards to commitments made regarding improvement on control relating accumulation of collected performance information for reporting in the annual performance report. We'll get into details of that now. I see the HOD is thinking. Members, is there other questions there? Other questions before we get to it? Is that fine? HOD, over to you, and then we'll get back.
Yeah, I think we're just a bit unclear, Chair, on that the MEC needs to get regular updates on something, but I couldn't quite understand what that was exactly.
Yeah, I think what more it seems to me that there was there was commitments made, and then somehow the AG said, and maybe the AG is here, he can maybe elaborate on that, to say that there must just be more communication between the HOD and the MEC regarding to commitments made. I've asked the AG that question, but maybe the AG can just give us some background on that. AG?
Thank you very much, Honorable Chair. The matter MEC and the HOD relates to the misstatements identified in the audit of performance information. Those misstatements were corrected by the department, and the issue that we discussed as a recommendation was that the internal control deficiency in its nature, it should be followed up and to ensure that it does not reoccur. And this is the matter. Then, in terms of the briefing, we calling to the MEC also to just ensure that it gets to happen. And just to add, maybe, Honorable Chair, that as the office, we're also going to meet with the department to ensure that we go deeper into the issue. And that meeting has not as yet happened. Thank you.
Thank you. Clear now, Minister?
Thank you, Chairperson. We take note of that for now and then look forward to that engagement just to get a bit more details on that. But yeah, we'll wait for that meeting to be set up. Thank you, AG.
Thanks, Chair. I think I'm clear on that. I think one of the areas we used to have, which we don't have at the moment, is the key control reports to the MEC that we used to do, and that was quite useful. But we need to formalise that. At the moment, the procedure for performance information reporting is that the quarterly performance reports are submitted to the MEC and discussed as required. But I think the issue here is also the reporting on the controls that are to address deficiencies previously picked up, and that the misstatement in question, I think it was it one misstatement that was picked up. It was a miscount on the number of subsidized spaces it was the number of subsidized after school centres. Yeah, it was a misstatement on number of funded after school centres. It was out by 6. Yeah. So that was and so that was corrected. But the concern obviously is how that mistake happened and to prevent a recurrence. So I fully understand. The question also from Honourable Member Nkondlo on the split in the budget. I think the expenditure on management support would not only include management, it includes the salaries of the social workers. So maybe if you can shed some light on that, CFO.
Thank you, HOD. Yes, in program 2, because of the category of services, all the services that they do in program 2, the social workers, the social auxiliary workers, as well as the graduates that we appoint, we cannot proportion their services into some of the other programs. So therefore, it was best that we all allocated into that one program. Hence, it looks quite heavy in terms of that, because that is all the salaries and all other expenses that goes with those officials in program 2. And this is in our 6 regions that we operate outside the head office of the department.
So it's the salaries of the service delivery staff. So it is for service delivery. It's not for management. It's actually management, but also the frontline social workers, auxiliary social workers in our local offices that service the public. The question about the catering, maybe the more detail could be provided. I think the in brief, the parenting program that is being run by our regions, they are identifying parents who are struggling with raising their children, where the children are potentially starting to seem neglected or at risk. They are arranging for those parents to come into a session or sessions with the social workers, where the social workers go through parenting skills development with them. Now, at those sessions, they need to have food because they're long sessions, so they have to have some food for the people who come there, and it also helps attract them to come and stay there and listen and participate. So that is what where the catering funds go. I think I don't know if Ms. van Reenen has an approximate number of parents that we reached, but I think that figure is also in the annual report. The several thousand parents reached. So the catering funds are for those several thousand parents who come routinely for the parenting program. So yeah, but we can provide more details if the need is there. Thank you, Chair.
Is somebody on answer? No.
Thank you. Yes, Chair. The donation was, we must first apologize. It's not Colombia, it's Gambia. So, that's Gambia. And this was a donation from the United Cities and local government. They gave us 43,000, and that is to attend a conference, GBV conference in Gambia. And that was it was on behalf of the French Development Agency.
Attended by officials.
Attended by our officials, yes. And then the only expenditure we had was obviously the S&T of the officials that we had to carry in terms of that.
Jump to the ministry head office, also donation chocolates, biscuits, and Atlanta trip, and that's 131. Elaborate on that.
Chair, the trip to Atlanta was funded by a US-based fund that was doing work on poverty alleviation and sustainable development solutions. They invited Minister Fernandez to attend a session of their global network. So they paid the costs of the travel and accommodation of the minister to attend that in Atlanta, USA.
Members, other questions? No other questions? Are we done? Are we done? Now, before I give the Minister and the HOD time for concluding remarks, every day I ask a member of the committee to do the thank yous. So that today is Member Petronella Lecker who's going to do the thank yous. So over to you first, Minister and HOD, and then your full name is Member Petronella Lecker is going to do the closing. Thank you.
Yeah, thanks very much, Chairperson and honourable members. We appreciate the oversight and the inputs that I think help us see things from a different perspective as well. And hopefully will help us to improve the communications so that there's fewer questions next year as far as possible. I'd also like to thank the team for their hard work on getting to this point of being able to close out the year under review. It's always very difficult, especially in our budget climate at the moment with extremely unpredictable budget changes at the last minute and very constrained resources in the face of huge demand. So I'd like to express my appreciation to all of the senior managers and all of the staff of the department for their contribution to everything that was done that is reported in the annual report. And then also to thank our incoming minister for his support to the department and ongoing encouragement for the current year, which we'll be reporting on next time we come before this committee.
Thank you, Chairperson. And since you are a seasoned public representative and also in this committee, you would know that if I would have been in the firing line if this was not a good report. But also now it is all credit to the staff we have in this department who's been doing an incredible job over a number of years, led by the HOD, the chief directors and everybody else. And in a province and in a country that we are facing an ever bigger need, the department really does a lot with the little that they have been entrusted with. So from my side, I do want to just publicly thank the team for the foundation and all the work they have done over the years that we can now build on. We are excited about some of the things that's in the pipeline for the upcoming years. So next time you're going to have us in this particular platform, then that will be the work done under the department, under my leadership. But from my side, thank you for having us and also for giving up your time and also for the AG to also keep us on our toes throughout. We brag with the good results we get from you, but it's not always easy, especially in an environment where you work with social workers and you're not always allowed to open files without those social workers with them, which is not something you're maybe used to. But thank you for understanding the environment in which this team also work and taking our hands to making sure we get this report. Thank you so much.
Thank you very much, Member Lecker.
Thank you, Chair. I think from the side of the chambers, I would like to firstly say that I'm sure your department, as we approaching another century of a democratic society, you would understand that there's challenges across the board. Your economic, social conditions are worsening. And in light of what I've seen in this report, including some of the centers that have lost beds, particularly for the children, taking into account what has been happening outside there with children, some of them neglected by their families. It then says there's a lot of work that has to be done from that side of yours, Minister. And hopefully one day we will sing a different story, that our children are safe, our children's cries, even as small as they are being listened to by government and something is being done. We've noticed the work that you have done, but it can never be enough. Being a public representative, seeing everything that I've seen outside there, it therefore says we all need to up our game in ensuring that our children are safe. With those words, I want to say tonight you must take a strong cup of coffee and re-energize for the next year, because probably we'll have more questions. It won't be less. It's gonna be more, because some of us are still finding our foot into this department. Thank you so much.
Thank you very much appreciated, Member Lekker. Department, the members will stay behind, the standing committee members. I don't know if the other members will stay for some of our resolutions, but thank you, Minister and HOD. You are excused. Thank you very much. Thank you, members. We just, Mr. Davis is going to read the resolutions, and then you can add where you see yours is not included, and then and that's all that we need to do today. The resolutions. Thank you very much.
Thank you.
Over to you.
Thank you very much, Chairperson, through you, honourable members. Yes, just some concepts that I've taken down. The first one is under governance. From Member Comfort, the department said that it will provide the committee with a report on the funding that was stopped for MPOs from 2019 to current date. That's under governance, page 93. And then under part E, Chairperson, we're looking at your transversal resolution that's going into the introduction of the scope report of the invoices paid. All departments must just give an explanatory narrative there in the following annual reports, and then a resolution from Imbonkondlo on the emergency procurement. How is the service provider chosen and selected? So Member Nkondlo indicated that she would like to make a resolution on that.
Yes.
So I will just have to word that in the scope report for resolutions, Chairperson. And then, Chair, basically it's also on page 201, Chair. It was on the parenting program and the catering that was spent on this event. The department indicated that they will give us information, RFI, request for information. And then, Chairperson, basically note is taken, Chair, by program 3. But I'm not sure, Chair, from the committee and yourself, if we should make that a resolution that the department can brief the committee on that, or just leave it, Chairperson.
I think they're meeting with the AG just to get some clarity on that point, so we can leave that out. All that we can ask them, did that meeting take place? And they must give us just maybe details on the meeting taking place to say that that gap is covered. Member Van Wyk, you want to say something?
Yeah, I think what I'd perhaps just, the fact that we're getting these repeat tenders, that, clearly it's something that took place at Provincial Treasury in terms of some transversal tender. And now it reflects in every single department, and it reflects in the annual report. So, perhaps as a committee, we just need to express our concern of the impact of tenders that are not renewed timeously, and that they need to be extended. and there's a practice that we should probably discourage.
Yeah. Yeah, but because now the contact is finished, it's almost like they didn't know the contact is going to end, and then they must extend. So we'll look into that one. Is there others? Is that it? Is there any additions? Member Petronella Lecker?
Just one, Chair. I think this one has caught my interest on page 171 on the subsidized beds funded. Can maybe we get a report on this?
Got it, Chair. Got it, Chair. Thank you.
Is there any other additions to Member Kontlo?
Okay, I want to support Member Van Wyck's resolution, Chair, is the first one. Chief.
So we're going to propose it and second it, okay?
The Chief Whip is actually messing with my head here. And then, Chair, on the, what is that, emergency procurement, what I wanted to know is that the CFO says they do a quotation to who? He says people there. Who are those people? Are they in the system? And what is the process of appointing the final one? Because he says it's a limited bid. Limited bid, my understanding is that you limit it to 1 or 2 people that would have been identified. So I'm still not clear about that process. Then I think, Chair, on the risk of increasing household hunger, I would still want the department to really come back to us about this thing of impact assessment. Because I think, Chair, one thing I think as a country and as a province we want to avoid is to create dependence. So whilst I accept the continuous evaluation, impact assessment says if we are giving people food because we want to ensure, that at a particular time they are no longer on the system, we are supposed to do impact assessment. It's the high end. Don't know what the HOD was trying to explain here. So for me, I think it's still important because you'd recall the Premier also in opening this parliament said he had asked the department, this one, education and health, to go and look at this additional food parcel. So surely we do not want to create some system of just giving people food parcels because we want people at the end to get out of that system. So why we need impact is to be able to say, is it working? So that also we do not create NPOs who are just wanting to exist because there's a food parceling type of funding. So I think for me, that is a very important thing that we must ask whether we take it back to the relevant standing committee to really look at that and follow it up because it's really important. I don't think with the financial constraints, we do have money, to continue to just expand and balloon, giving people food. It's nothing wrong in the circumstance, but it must be something that we are working towards our. Yeah. Thank you, Chair.
Mike?
Yeah, certainly, I would support what my colleague is saying there. I think what we must just emphasize the fact is that we, as indicated, we can't continue creating dependency as such, and we've got to find a solution that citizens can start becoming more self-sufficient. In other words, we're also talking about jobs in effect.
Thank you. Member Frans Mabombo.
Thank you. Still on the nutrition, I think the HOD did indicate that a research that was conducted by HELP demonstrated focus of child malnutrition. So at the time, it was crucial to involve agriculture because in some of those areas, it's actually in the areas where there's a high production of food. So it was on the basis that we cannot be a country or a province that boasts about the export, and yet the actual food producers are the ones who are malnourished. Therefore, the child malnutrition, which is when the child malnutrition, is a proxy of the fact that that family is also have got the issues related to food access. Because I don't want to say insecurity, there is food, but in terms of whether they access. So what we need to do, it's about whether it's through the oversight or get more information. Don't just have only like a blanket kind of information. If it's about in board refill, in farm A, B, C, D, that's where child malnutrition is. It's not only about the cost package of like a soup or a meal that's going to give to the child. It means that the mother, it means that the grandmother and everyone, which it does have a huge impact as well when you have got adults who have got, whether it's a malnutrition or whatever that is. So for me, what is crucial is about information on the specifics. Where are these pockets and also the progress in regard to, from their side, social development is about, they will have households and they'll have whatever that kind of information. And then the other part is about agriculture side now, which is not part of this, in terms of, because they're the ones we're also helping in terms of the root causes. And then lastly, for the health, because they're the one now who will be able to determine, because they weigh the children and so forth, they could be able to demonstrate around that. So that is one part. I don't know exactly what I'm saying, whether it will have any part, but as long as you understand what I mean. The second thing, on the issues of the rehab, one of the, most of the rehabs, they are under the NPOs. I think the social development got 2 or 3, but generally it's about at what extent that they are, and then I think there was one that was closed because they have different, the one that used to be owned by the government. That's why now they're done mostly by the NPOs. At what extent does the department plan to open rehabs? Because one of the impacts is about, especially for the adolescents and the youth, they ended up unnecessarily staying longer, and also it does have an impact at the mental health hospitals, where a person does not necessarily has got a mental condition, but because of the behavior, it does impact. Then they ended up being stigmatized. Yet they're supposed to go to rehab, but most of the rehabs, they are based on the NPOs, which they are funded by the. At what extent that they will have their own to add? I think there used to be 3 and then 2. I can't recall. At what extent in terms of the rehab? I don't know exactly what does it mean, but I'm just throwing based on the knowledge around that. Thank you very much.
Thank you very much. Members, there's nothing else, eh? Meeting's adjourned. Remember, there's something to eat at the back. Member Van Wyk wasn't there yesterday, so you have 2 helpings waiting for you. Thank you.